Welcome everyone to the Whole Health Louisiana Semi-Annual Summit. We are delighted that you could join us today and look forward to sharing information on how the first 6 months of this 5-year initiative is going. My name is Liz Skilton. I'm an Associate Director of Research at the Kathleen Babineau Blanco Public Policy Center, where I head the Whole Health Louisiana implementation team. I'll be today's session moderator. You can think of me as the flight director, just kind of controlling things from above. Today we have a variety of panelists who support the Whole Health Louisiana initiative, including those from the Louisiana Department of Health and Bureau of Family Health, such as Assistant Secretary Tanya Joyner and Trauma Resilience Strategy Manager Christine Lobre. The Whole Health Louisiana Coalition is also represented by Ron McClain, and the Blanco Center is represented by our Director of Research, Anna Osland, Research Associates, Emma Willis, Brooklyn Thibodeau, and Quen Nguyen, and our Communications and Public Affairs Specialist, Fallon Chiasson. As part of this inaugural summit, we hope to share with you an overview of the Whole Health Louisiana Plan, an implementation update for the first 6 months worth of activities, a spotlight on our coalition members and how they shape and support our initiative's progress, and how you can get involved with this initiative. We'll conclude the day with a question and answer session, and we hope to kind of hear from you as to what you want to know about Whole Health Louisiana and the activities that have been going on and will continue to go on over the next 4.5 years. And without further ado, let me introduce Louisiana Department of Health's Assistant Secretary Tanya Joyner, who will introduce the Louisiana Whole Health Initiative. So please take it away, Assistant Director Joyner.
Great. Thank you, Liz. Good morning, everyone. I'd like to first thank the Kathleen Babineau Blanco Public Policy Center, our Office of Public Health Bureau Family Health team, and the many community members, providers, and childhood adversity experts who were consulted on the challenges and opportunities to prevent childhood trauma in Louisiana. This initiative really resulted from a year-long discovery process, which is why LDH has been so invested in being an integral partner in this initiative. It is collaborative. Change is going to result from the sustained work of all of you. So I want to thank you for your continued belief, your participation, and your commitment to this very important work. One of the major early insights from that discovery is that reducing adverse childhood experience is a shared goal amongst many different stakeholders, and the substantial change resulting in improved outcomes would not be accomplished by a single stakeholder or organization. The Whole Health Louisiana Plan is at its core rooted in the foundations and principles of public health. A key part of the public health framework is social determinants of health, understanding that numerous factors influence someone's health, such as access to resources or exposures to toxins, diet and access to healthy foods, health services, socioeconomic status, education, and of course, traumatic life events. In recent years, there's a growing body of evidence that a child's experience in early life have significant long-term impacts, good and bad, that these experiences are significantly connected to health behaviors and health outcomes. Prolonged exposure to toxic stress as a result of childhood adversity is linked to chronic health problems, mental illness, and substance misuse in adulthood, all of which are significant challenges in our state right now and policy priorities for the department. Specifically, there is a significant burden of chronic disease. Louisiana ranks 45th in the nation for the percentage of adults with 3 or more chronic conditions, including arthritis, asthma, chronic kidney disease, cardiovascular disease, depression, diabetes. Our drug overdose rate has increased annually by 9.2% over the last 3 years and is 36.7% higher than the national overdose death rate. Many of our goals within the department through our state health improvement plan range from reducing the prevalence of chronic diseases, reducing deaths from drug misuse, to promoting health and safe environments and improving community readiness and resilience, which are intimately connected to the goals of Whole Health Louisiana, and frankly, not possible without reducing the prevalence of ACEs. I know that this is going to be a huge task and a heavy list, but it's very important and possible work. On the individual level, these objectives include connecting youth to activities and caring adults, teaching essential healthy relationships and emotional regulation skills, and offering accessible, culturally responsible therapy or treatment options to mitigate immediate and long-term harms. Protective factors on the community level include leveraging our policies and programs to actively and positively impact the social determinants of health that sustain healthy families and communities. These include, but are not limited to, enacting policies to dismantle the drivers of structural and systematic inequities, robust health and educational systems, supportive access to basic needs such as housing, food, water, and family-friendly policies in the workplace that support and protect our employees. So I want to once again just thank you for participating in this very important initiative, and I really hope that you all enjoy the rest of the summit. Thank you.
Thank you, Assistant Secretary Joyner. Moving right along, I'm going to turn things over to Christine Lebreur, the Trauma and Resilience Strategy Manager for the Louisiana Department of Health. So Christine, please take it away.
Hi, Liz. Thank you, Assistant Secretary Joyner, for framing the issue that brought about this initiative, and thank you to everyone for joining us today. Liz, are the slides up? Okay, perfect. So many of you are familiar with Whole Health Louisiana, so I'll just be providing a brief overview of the initiative, the work that has informed it, and the priorities that guide current and future implementation activities. Whole Health Louisiana is a statewide collaborative initiative that seeks to address drivers of childhood adversity by promoting evidence-based strategies proven to prevent and mitigate the impacts of childhood adversity and trauma. The initiative is guided by the state plan developed in collaboration with many of you and hundreds of others from across the state that have lent their voices over the last several years. We've included a QR code on the slide that will bring you to the Whole Health Louisiana landing page with links to the state plan and the reports that inform the plan's development. You can move to the next slide, Liz. The initiative was first conceptualized in 2021 within the Bureau of Family Health. While the initiative is fairly new, the Bureau has led and supported upstream evidence-based strategies to prevent experiences of childhood adversity for more than a decade. The work of the Bureau, best practices gathered from other states leading similar efforts, and the trauma-informed initiatives and research conducted throughout the state have all informed the plan development process. The first two phases, the community-based statewide discovery process and the November 2022 convening, served as the foundation for developing plan priorities and structure. The third phase of the process, coordinated by the Louisiana Department of Health through the Bureau of Family Health, was guided by a steering committee, supported by cross-sector working groups, and informed by advisory bodies and community conversations held throughout the state. The plan was released in November 2023. The mission and the vision of the plan require all of us to work together to transform our approach to providing care for children and families by raising public awareness, amplifying evidence-based policies, sharing data for future decisions, and supporting our workforce to expand trauma-informed efforts statewide. Through these efforts, we envision a future where all of Louisiana's families and communities are thriving. You can go to the next slide. And Liz, let me know if I'm still on topic because I can't see the slides, but I think we're rolling through. Okay, perfect. Through the plan development process, 4 key priority areas were identified. We'll go on to the next slide. The priority areas of the state plan include cross-sector collaboration with a goal of more effective collaboration between our systems of care to improve outcomes for children and families, building awareness through the promotion of evidence-informed public education at all levels, so our state's decision makers, child and family serving workforce, and the general public have a greater understanding of and a decreased stigma towards childhood adversity and its impact. Third priority area focuses on advancing prevention and healing through programs and initiatives that are culturally grounded, trauma-informed, and healing-centered, so that Louisiana's residents can access the services they need to prevent and/or heal from the effects of trauma. Lastly, but importantly, the plan prioritizes supporting our current and future workforce to ensure that Louisiana's child and family serving agencies are trauma-informed and healing-centered, both for the benefit of those they serve and for those working within those organizations. We can go to the next slide. The state plan provides a roadmap for the 5-year initiative. Utilizing a tiered implementation structure outlined in the state plan, we have worked together with the Whole Health Louisiana's state lead agency and the coalition to build and scale the initiative in 3 phases over the next 5 years. Phase 1, the ACT phase, began in July of this year and will extend through December 2025. This phase focuses largely on public education, coalition building, and the initiation of objectives and recommendations with partners and decision makers across the state. The second phase, the adapt and build phase, spans 2026 and 2027. The focus of this phase is on further integrating quality improvement efforts to ensure the implementation of state plan objectives and expanding activities are in alignment with stated goals and priorities. The final phase, the sustain phase, will be conducted in 2028 and will complete the 5-year initiative of the department. During this period, LDH will complete its transition out of a co-leadership public sector anchor role while retaining membership in the Whole Health Louisiana Coalition and supporting ongoing efforts that align with LDH programming. The work is led by the implementation body, which includes Louisiana Department of Health as a public sector anchor, the Whole Health Louisiana Coalition, and the statewide lead agency. The coalition is comprised of members of state agencies, healthcare professionals, child and family service providers, representatives from local community organizations, parents, caregivers, and regional stakeholders from across the state. While many of you are familiar with the Whole Health Louisiana statewide lead agency, I'd like to provide a quick introduction. The Kathleen Babineau Blanco Public Policy Center, guys, it's a mouthful, so I'm going to get it out. Kathleen Babineau Blanco Public Policy Center is an independent interdisciplinary research center at the University of Louisiana at Lafayette. And they were selected as the Whole Health Louisiana statewide lead following a series of interviews with a strong pool of applicants. Blanco Center is committed to serving the public interest through leadership in state and local policy, focusing on education, poverty and economic opportunity, criminal justice reform, health and healthcare, bringing together experts from different fields to conduct applied policy-related research and assist those making and implementing policy in Louisiana with best practices. Blanco's dedicated areas of focus align with the priorities of Whole Health Louisiana initiative and have well positioned their team to lead the implementation of the state plan. And with that, I'll turn it over to the team at the Blanco Center.
Thanks, Christine. So to start us off talking about Blanco Center's role with the implementation of Louisiana's statewide plan, I'm going to turn it over to Anna Osland, who's our Director of Research.
Hey, I'm very excited to be here and to be participating in the Whole Health Louisiana implementation of their plan. So as a reminder here, we received a warm handoff from the creation of the plan and all of the work that partners had put into that over the last few years at the end of May. So we've been running as fast as we can, getting on board, really getting excited about all of the possibilities for implementing this plan over just a few short months. So as we get started today talking about implementation, just know that we have not really been here this long, and we are standing on the shoulders of all of those who came before us and all of the deep work that has been put into this across the state, from families to communities to state agencies, partners, and really, the Bureau of Family Health and the Louisiana Department of Health and all of the leadership that's gone there. So we're super excited for all of that work and how we can continue to build on it. So our team has a lot of enthusiasm. And if you go to the next slide, Liz, I'll just talk a little bit kind of high level about our role. So as the statewide lead, we are really doing 3 things. One is focused on implementation, of course, of the plan and collaboration across the state of Louisiana. The second piece is gathering data and analyzing that data, and just thinking about like how we can make what we're doing effective and how we can really contribute to changing course as a state as we think about trauma-informed care and what we're doing collectively to impact children and families in our state. And part of gathering that data goes into evaluating how well we as a state are doing, both in the implementation and just across the board and the impact that we're making. So I'm going to pass it back to Liz, and then you'll hear from several other Blanco Center staff that'll tell you more about the different pieces of what we've been doing this year. But just know we're excited to be here and are just so thrilled to have been chosen as the statewide lead to be able to work with all of the great partners here.
Yeah, absolutely. So our first 6 months of activity with the Whole Health Louisiana initiative has been filled, as Anna said, with a lot of energy and enthusiasm for kicking off the plan's goals of how to address childhood adversity and trauma in the state. As the head of the Blanco Center's implementation team, we aim to strategically implement the activities that raise awareness and support collaboration among various champions across the state. In the first phase of the plan, we focused on who could reach out to and engage in this process, how we can build areas for engagement to raise awareness of trauma-informed care practices, and how we can foster the implementation of these practices in our state's workforce. This includes, as mentioned before, working very closely with the Whole Health Louisiana Coalition, which includes individuals who were part of the planning process to create the 5-year initiative. It also includes working with regional and local champions of this initiative who want to see this change implemented across the state, but might lack the resources, support networks, or time to do broad-scale implementation efforts. Overall, our highly collaborative team, including regional and local champions, has worked really hard to bolster awareness and collaboration in all regions of the state through several key activities, which my colleague Emma Willis is going to walk us through right now. So Emma, please take it away.
Thanks, Liz. Hey, everybody. As Liz said, my name is Emma. I'm a research associate with the Blanco Center, and I'm just going to give you guys a quick little breakdown of all of the events, our successful activities that WHL has hosted over the last 6 months. This includes our regional trainings and our Lunch and Learn webinar sessions, as well as our bi-monthly meetings with the WHL Coalition, who, of course, helped develop the plan to begin with. And, of course, today's semi-annual summit. Next slide, please. Okay, so far we've put on 5 of our 9 planned regional trainings in Lafayette, Baton Rouge, Shreveport, Alexandria, and Lake Charles. And we've got 4 more on the way in New Orleans, Homa, the North Shore, and Monroe, and those go through January of next year. Next slide, please. Overall, we've had 76 attendees at our regional trainings, and we've issued 42 continuing education completion certificates in social work, nursing, and licensed professional counseling. The table right there kind of breaks down those numbers further, illustrating both kind of the number of local resources that participants shared at the trainings, which we are collecting, and the number of attendees who completed our surveys. If you take a look at the map above, it's based on those survey results. You can also see which parishes each of our attendees came from. Next slide. Thank you. Our other major event series, our monthly Lunch and Learn webinar series, has grossed over 71 total attendees between September and October's events, including 26 participants who earned CEU credits. And that's just 2 events, with another one coming up next week. So hope to see some of you there. Once again, we have an attendance distribution map based on those who completed the survey right there. And I think that's everything. So I'm going to hand it over now to Brooklyn to kind of go through some of the challenges that we faced through this process and how we've overcome them.
Hey everybody, I'm Brooklyn. I'm a research associate at the Blanco Center. So the challenges that we faced in year 1 was, of course, first knowing how and where to start implementing the WHL plans, getting people to register and attend the regional training and the Lunch and Learns, and then also mapping out a big network of regional and area-specific resources and needs. You can go to the next slide. So how did we here at the Blanco Center address these challenges? As I mentioned before, we had continually tried to increase our attendance rates at the regional training and lunch and learns. So we first did outreach through our known networks of coalition members and those associated with working with the plan. Then we started doing a mass organization outreach, including all of the nursing, social work, counseling, and psychology programs across the state. This included contacting over 138 different individuals at these said programs that include directors of the programs, department heads, and even the instructors. This kind of outreach increased our regional training registration by over 50%. We also contacted over 55 different organizations and nonprofits across all the 9 regions. Some of these included partner organizations of some of our coalition members. And then lastly, we work really hard to map out region-specific resources. Since then, we began polling the attendees at the trainings about local resources and their needs and requests. And we also shared any resources that were shared during the trainings with our attendees in a post-event email so that they were aware of the resources that were available to them. We can go to the next slide. So now, what do we have planned for the next 12 months? In terms of regional training, we do have our New Orleans regional training on the 12th of this month, followed by our Houma training in December, and then our North Shore one. And then we have our rescheduled Monroe training, which is going to be in next year, in the new year. And then meanwhile, our next Lunch and Learn webinar will be on November 4th, which will be led by the ACES educators on different strategies for parents to build resilience. In December, our Lunch and Learn series will continue with a presentation by Executive Director of the Campaign for Trauma-Informed Policy and Practices, Jessie Kohler, who will speak about trauma-informed workplaces. The Lunch and Learn series will continue monthly in the new year as well, with planned webinars from January up until June, which will feature a host of different engaging speakers with topics about trauma-informed care. And then next week on the 7th, we have our next coalition meeting. And then lastly, our next semi-annual summit is scheduled for April 24th next year, which we hope you all will join us at to hear more about the WHL initiative at year 1. I will now turn to Ron McClain, who will share their perspectives as a coalition member.
Well, good afternoon, everyone. Again, I'm Ron McClain, Executive Director of the Institute of Mental Hygiene and Chair of the Board of United Way of Southeast Louisiana. So first, my personal experience with being involved in the planning and implementation phases. Well, it began very early on when, as a Public Policy Committee Chair for United Way of Southeast Louisiana, I received a letter from Delary Rice, who asked United Way to make an investment in this whole health planning piece, which I wasn't quite familiar with. And I'll revisit that later. But it made a whole lot of sense to me to sort of support an effort to ultimately improve outcomes for our children who are connected with the child welfare system. And so after hearing from Delary and others, I put something together to present to the United Way Board of Trustees in an effort to secure an investment of about $77,000 to begin the planning process. And so this is what I mentioned to our Board of Trustees as a part of this process for soliciting their support for the planning and initial phases for contracting with Trepwise. I indicated that the Whole Health Louisiana initiative is consistent with the ongoing policy and advocacy work that is being led by United Way of Southeast Louisiana. This supports our anti-poverty agenda, but more importantly, addresses the crisis many of our vulnerable families and children are facing throughout Louisiana. The opportunity to work in partnerships with the governor's office and others on this important health initiative will drive increased funding and support the many programs we are currently funding in the greater New Orleans region and beyond. This will also allow us to increase federal funding to support implementation of a comprehensive plan of action. Well, the board decided that they would make this investment. It was aligned with our mission. And so that began my involvement. From there, I was invited to become a member of the inaugural steering committee, which I enthusiastically accepted, and started attending the sessions. And believe me, it was an involved process because there was much pre-reading and preparing for the sessions. We were involved, engaged. Trepwise did an excellent job at pulling information from us in an effort to get the relative input from stakeholders and interested parties to, to craft this plan. And so I attended all of the sessions, kind of went through the workout groups and tried to be seriously engaged in a process, along with colleagues who were very much engaged. And so this was a really important thing for me personally, because trauma, adverse childhood experiences has been a big part of my life in terms of responding to the needs of children and families who I worked with as a social worker. And so in terms of my reasons for being really excited and committed to this planning process, I have to tell you, it started very, very early on, even before I had any idea what Whole Health Louisiana was all about, even what ACEs was about. Some 40 years ago as a social worker, I worked at Milne Boys Home in the Youth Study Center, which is now the Orleans Juvenile Justice Intervention Center, about 40 years ago. And much of what I saw was with boys who had had serious trauma experiences, and their behavior was symptomatic of those experiences. It was really difficult to kind of deal with it. First, I didn't have the understanding of ACEs and trauma and the need for trauma-informed systems of care. I just knew we had a consistent theme of boys and other children who had been traumatized, had been victims of child abuse or neglect, had been involved in households where there were drug use and family members being arrested. All these things, sort of collided to impact how these children behaved. And so didn't know what to do with them, but certainly reflecting on my early experience makes me more and more excited about how important this effort is. Another thing that happened maybe about 10 years ago when I first became executive director of the Institute of Mental Hygiene is that we had Vince Felitti as the annual meeting speaker. That was my first annual meeting speaker. And for those, just a reminder, Vince Felitti and Robert Anda are the architects of the ACEs study many years ago in San Francisco. And so we had Dr. Felitti as our annual meeting speaker. And in a flyer, we invited stakeholders and interested parties to come to hear Dr. Vince Felitti present the findings of the landmark 25-year Kaiser Permanente CDC study. And that study obviously indicated that there were dramatic links between adverse childhood experiences and risky behaviors, psychological issues, joblessness, divorce, serious illness, and death in adults. We ended the flyer with this statement: please join us for breakfast and learn why the Center for Disease Control and Prevention estimates that the lifetime cost associated with adverse childhood experiences in childhood is $124 billion. Folks, this was 10 years ago. This was 10 years ago when the data would indicate that these costs associated with adverse childhood experience and childhood trauma was $124 billion. Unfortunately, that number probably has risen. And that's one of the reasons why I'm so excited about being involved in efforts that will reduce those costs significantly, but more importantly, support our families. Another thing that happened, I was involved with a colleague of mine who all y'all know, Dr. Paula Zena, who led an initiative called View from the Field, Awareness Activities Approaches for Addressing Adverse Childhood Experiences. And this was really the first statewide snapshot of ACE-related activities in Louisiana. So all these things make me excited about being involved in this effort because this has been my life's work. And it's so important. And Dr. Journa early on, kind of gave us some information about the disparities experienced by children and families in Louisiana. Unfortunately, we are disproportionately impacted by trauma among children, obviously based on the things that are represented in ACEs, but also the weather events that are so common and increasing that causes trauma, that exacerbate some of the other issues that causes trauma in children. And so we are disproportionately impacted. And it's important that we find ways to work together, the system, to deal with systems issues. And I don't think we can do more important work than to help our state leaders and our state workers in the child welfare system understand how to work with children who've been traumatized. And as I come to a close, the benefits from being a coalition member, while working to make real meaningful systemic changes to ensure that our families involved in the child welfare system gets the support they need. This is especially important in the current context. Collaboration, collective impact, and doing it in a united way will lead us where we need to be. And I'm so happy to have had an experience and continue to be involved in this coalition. I believe and I'm hopeful that it will make a difference. And quite frankly, it's already making a difference. All the people who have been involved have been seriously educated about these issues, how they impact children and families, and more importantly, what we can do about it. And so here I am standing, very, very, blessed, I feel, to be involved in this process because it's going to ultimately relate, and it's probably currently relating in better outcomes for our children and families. Thank you for having me.
Thank you, Ron, so much for sharing your experiences with being a coalition member. It was great to hear about the early phase and then where it's going today, and your optimism just shines through as always. So we definitely appreciate all of the support by our coalition. They each play a very distinctive role in kind of informing this process, helping us envision what it can be in the future, and where we want to go in the next 4.5 years. So thank you again, Ron. To move on to our next topic here, we are going to transition to how you could get involved, maybe in serving as a coalition member, supporting the initiative, or otherwise. And I'm going to turn things over to Fallon, who handles all sorts of media and public relations for the Blanco Center. So Fallon, please go ahead.
Hi, everyone. My name is Fallon Chasson. I'm the Communications and Public Affairs Specialist at the Blanco Center. Just as everyone said, I want to echo that this is an amazing project to be included in, and we're just doing amazing things here to share the mission that we've all put together. On the screen, you'll see a link to join. It'll lead you to our link tree, which is just a website that hosts a lot of links. There, if you click it or scan the QR code, you'll be led to a site where you can sign up for our lunch and learns, our newsletters, regional trainings, and you'll be able to see the YouTube page that hosts the previous lunch and learn. So if you missed that, you're welcome to go and check that out. If you continue scrolling on that page, you'll see the Blanco Center's website as well as our social media profiles. That's where we are primarily engaging and informing the public on these events that we're having, as well as other resources about trauma-informed care. So a very easy thing you can do to support this is just follow, like, and repost the things that we post on social media. Thank you.
Thanks, Fallon. I do want to echo that, if you want to join us in any way, even if it's not participating in the coalition or attending the trainings or the lunch and learns, which I do really recommend, they're wonderful webinars. Feel free to get in touch with us if you have any ideas or ways that you'd like to connect at WHL@la.gov. Sorry, I had something black on my screen there. So that's WHL@la.gov. We welcome all input on this initiative as it is a statewide initiative, and it doesn't work unless we from the state are involved in that. So now we kind of wanted to turn things over to ask you if you had any questions for us about this first 6 months of the initiative, the Louisiana Whole Health Plan, or activities that are potentially upcoming or ways to get involved. Leading our question and answer session is going to be Quinn Nguyen, who's highly skilled at running Zoom's webinar question and answer format, and will provide a bit of instructions as to how to do that in just a second here. So Quinn, please feel free to take over at this point.
Thanks, Liz. Hey, y'all, I'm Quinn. So we're going to go ahead and start fielding some questions. So if you have any question directed to any of the members here on our board for Whole Health Louisiana, feel free to put them in the Q&A box. It's down at the bottom of your screen on the Zoom screen. If you see the little Q&A, you can type in the question and we will answer and address it. So I'll wait a couple of seconds for you guys to start thinking about any questions that you may want to ask anyone here about our Whole Health Louisiana team, the implementation plan, evaluation plan, data plan, anything that we discussed during today's semi-annual summit meeting, as well as any other questions that you may have for anyone here at LDH, or if you have questions for Ron about his coalition member status. Is anyone having trouble typing or sending a question? Well, I guess you guys can't answer that because we're on a webinar. So
I'll say that I'm having trouble with that. So I don't know, we may need to enable the chat. We've had a few problems with our webinar Zoom, just the way that the university sets them up. So just give us a second while we get that figured out.
It looks like it is working. So
okay,
Carla, thank you for
now?
telling us. Susan, we really appreciate it.
Okay, good. Awesome.
Okay, thank you, Carla and Susan, for confirming that the chat box, the Q&A works. We do have one question from Julia asking what organizations or organization types are involved in the coalition. Liz or Anna or Christine, anyone, can you guys?
Yeah, I think I can start with this, and maybe Christine can second with some additional information. So we've seen a broad swath of participation by organizations in the Whole Health Louisiana initiative. This includes those that are interested in or serving childcare or child serving populations, those that work within the healthcare system, those that work in the juvenile justice system, and those that work with schools in particular. So that can include K through college. We've had a lot of success reaching out to various departments across colleges in particular, who seem really interested in providing training opportunities and getting their students to the trainings or to the webinar series as a way of kind of furthering their education within that space, since they will be the workforce of the future. So that's who I've seen across this spread, and I'm sure that Christine and Emma can answer some more, because I know Emma's within all of our data keeping track of who's signed up for various things, and Christine, you have the institutional knowledge that we are all just catching up to always.
Yeah, the coalition consists of individuals and organizations across the state that serve children and families. That includes state agencies. Just looking at the participant list for today's summit, we have folks from the Department of Children and Family Services. We have folks from the Department of Education. We have definitely have university representation across the board. We have all of the folks that are working together on the Children's Justice Act in attendance as well. We are working with as many partners as we can. And one of the things that's been really great about the coalition, because we really don't want to replicate any existing work. And that's often what happens when coalitions are formed. So what we've done is we've reached out to the coalitions that exist across the state that are driving initiatives that align with Whole Health Louisiana, like the Go Far Coalition from the Louisiana Policy Institute for Children and others, to come together so that we can have those voices in the work that they've already done, and we can amplify their efforts and support those efforts. So from parents to caregivers, teachers and school administrative staff, to people in the mental health and behavioral health space, people in the medical care space. We have folks that have come in, our social work board, the Louisiana Professional Counselors Association. We have multiple folks. We really want to make sure that this is a cross-sector collaborative effort. And so while we have great representation from many sectors across the state in our coalition, we want it to continue to grow.
Yeah, and I think that I was just on that last point, we are growing and we've been excited to see new members joining, and also seeing colleagues get their, other colleagues at their office to join as well. So that's, I think, one of the real interesting things is if you look at a coalition that's formed of individuals versus organizations, that as we've grown in training and continue to build on the great foundation that was handed to us in May, we've seen that continue to grow, and we're excited to see where that goes this next year. And so, I will say that that is an opportunity too for everyone who is a coalition member to invite your friends to consider joining as well, and to continue to support the initiative, because this is a big deal. This is huge.
Yeah, and just to add something as a coalition member, it's really important for the early care and education organizations to be involved, including child care facilities and their staff. One of the things that we learned is that so much brain development happens during 0 and 3, and that's where a lot of these adverse childhood experiences happen. And if they go unchecked, obviously, we understand that we'll be seeing them within the systems. And so we need more and more early care and education groups and those who work with them to be involved in this effort. There's nothing better than preventing this trauma, preventing the morbidity that sometimes happen as a result of these things. So please, let's get the early care and education folks continue to be involved. Dr. Sonia's group is obviously involved, and we've supported them both at United Way and my agency, Institute of Mental Hygiene. But we need a lot more stakeholders and interested parties in that arena to be involved.
Thank you all for your answers. We have another question from Stacy Overstreet, as she has raised her hand. Liz, can you unmute her so she can come on mic and ask her question, please?
Sorry, I was randomly pressing buttons. No question.
That's okay. We figured out how to unmute. So if anybody else needs to ask it verbally, just raise your hand, and that's how we'll be able to do this.
Yes, the raise your hand button is also at the bottom, next to the chat button, and you can click it to raise and unraise your hand. We have another hand raised from Paula Zena.
Hi, thank you guys for offering this update. It's great. I'm curious about two things. One is what you mentioned that you're hearing from a lot of universities about what they're doing to involve, to get students more involved. I'm just curious what you're hearing, if you could add more details about that. And I'm also curious about how it's going in terms of enlisting healthcare professionals.
Yeah, absolutely. The question about universities and that involvement, I'm going to kick to Brooklyn and Emma, who have been in direct contact with, I forget the exact number, but Brooklyn can give you the update across Louisiana and talk about the response rate there.
Sure. So yeah, I emailed a couple folks, and the response was pretty much they're really excited about the WHL initiative and they want to learn more. And if they were able to attend the training, they wanted to know like the PowerPoint, how can they get involved? So people really are interested in the initiative for sure.
Yeah, and I can add to that a little bit. So whenever we reach out to universities, we're usually kind of contacting like administrative assistants or deans who are able to kind of distribute all of our materials to as many students and faculty as possible. And sometimes they don't reply per se, but then as the invites and all the tickets to the lunch and learns roll in and people start signing up for the regional training. So even though they might not respond, they're getting distributed. The information is getting out there.
Yeah, we're finding good success with the online webinar series in particular. So the Lunch and Learns, which take place between 12 and 1. It's a 1-hour event, and that seems to be highly popular amongst a broad range of people because the time dedication is much lower stakes than attending the larger regional training. But I will say that the interest in regional trainings that we've gotten across the region has been more about could we do a regional training in the future, for instance, that targets a very specific group or workplace. So you mentioned healthcare professionals, Paula. That is one of those areas where we've received some requests related to that. And so when we're thinking about where does this initiative go in the next year, we're going to be talking to the coalition about what does that look like, and can we add this on as something that we can do that's a little more catered to different types of workplaces and groups that are requesting these types of trainings. So that's kind of, I think, where we're headed, and we look forward to talking to the coalition more about it and strategizing on that moving forward.
Great.
I'd also say there's an opportunity there that if you are in a field where you think that there is an opportunity for collaboration, to reach out to us, because we're very open to thinking about how we can extend our reach.
Yes, thanks, guys, for your answers. We have another question in the Q&A from Hung Chu Lin. She asked, how do the data from the pre and post training surveys currently available inform us about the effectiveness of the training? What is the overall feedback from the participants? Emma and Brooklyn, I'm going to kick this to you guys, since you guys have a lot of insight on the data that we're getting from our surveys.
Yeah, I can speak to this. So most of the feedback has been overwhelmingly positive. People find the information presented as very useful to extremely useful. That's kind of our options on the question. And we've been kind of tracking their feedback and their suggestions over time to kind of make sure that we're meeting everyone's expectations, and we're kind of adjusting things to make sure that it's addressing the things that people hope that it would address. We've kind of adjusted some of our activities for this very purpose. So it's been fairly well so far. Brooklyn, do you have anything to add?
No, you said what I was going to say.
Okay.
Yeah, I want to add the surveys are really helpful for us to adjust anything, any concerns or any issues that were going on in our regional trainings. And people seem to be really engaged with when they're taking the surveys, and it's been really helpful. We have another, oh, okay. I saw a hand raised in the chat, but it's not there anymore. So if anyone wants to come on mic and ask a question on mic, feel free to do so. Don't be shy. So for now, we'll just sit here until someone else asks a question.
And as a reminder, if you want to ask a question, raise your hand. And I do want to acknowledge, so we saw it was from DCFS Secretary David Matlock, but I'm not seeing you on the call right now. So just raise your hand again if you're still here. We want to make sure to answer the question. And the same goes for anybody else if you want to talk verbally. Otherwise, the question and answer chat box is just fine. Okay, well, we'll give it another minute here to just make sure that no further questions are going to come in, and then we will wrap up with next steps.
So I have a question, or just hopefully somebody can respond to this. So how will we communicate and assess the impact on the workers who directly interface with consumers, children and families? How do we know that we've made a difference in how trauma informed, quote unquote, they are, or if they're doing anything differently as a result of increased knowledge about ACEs?
Yeah, I think I can take this one and Anna can second me on it. Our evaluation team, including Jordan Thibodeau and Eric Mills, are working really hard on this question of assessment and how to know if what we're doing is making that larger impact. Initially in the first year, particularly the first 6 months, we're judging a impact level in terms of attendance rates, interest in whole health initiatives, and generally the desire for more of what we're providing initially. And I think what we're really seeing is that there is that desire there, which you knew from the planning stage, I'm sure, and that the desire is just to continue to grow the number of people who can have access to this type of training, to these resources, and to the community of individuals working within this space. As we look at, where to go in year 2 and beyond, I think that the evaluation team is really thinking strategically about how do you measure long-term impact within a workplace, and we're starting to kind of churn through ideas on, what does that look like to do that type of measurement, and what do we need to do from both the Blanco Center and LDH side to support the growth of that within a workplace. And I'm sure Anna can talk a little bit more specifically as she's really cued in with the evaluation team and what they're up to.
Yeah, Ron, I think that's a great question. And as we think about growing the impact of this initiative, that's going to be key to looking at how successful we are and thinking about sort of the long-term impact we have on children and families in Louisiana, but also on workplaces, because we can't underestimate the importance of those sort of first responders, if you will, that are there identifying children that might need additional support, and think about what are the best practices that they can do in their workplace to make sure that they are a place that is leading with trauma-informed care, and thinking about how they are addressing the needs. I mean, certainly addressing the needs of children first is out there and important, but if we can use research-based best practices to make our work even more meaningful, that's unbelievable. So this year we've started the regional trainings and the outreach with more of a informational reach. And, we have seen groups come like 1s and 2s from different places of work. And we're seeing that maybe isn't enough to impact whole scale change. And so as we look toward year 2 and in working in partnership with the Department of Public Health, we're thinking critically about what needs to happen and how do we need to evaluate it as we continue to move forward. So I think as we think about this as an initiative that is really, at the very beginning stages, we've done this in-depth, well, not me, but you did all of this, and the coalition did this in-depth research about where we are as a state to begin with. And we're just going to be moving forward with thinking about how we can address in different ways all of the challenges that we have here. We have a long way to go. We know that as a state, we are starting pretty low. And so it's going to be amazing what we can do together. But truly this is a partnership, and it'll be working with folks like with your organization, with others like you across the state that are going to really make a difference for the children of Louisiana. So more to come.
Yes.
Thanks.
Thank you all for your questions. I think they raise a lot of good points in terms of, what do we want to know about Whole Health Louisiana? Where do we want to go? Where do we see the enthusiasm for it? I also want to thank you all for joining us, and the panelists, especially for speaking today at our first Whole Health Louisiana semi-annual summit. We hope that the information shared today helps you understand the state's ambitious plan, related activities, and how to get involved or support it further. Before we wrap up, I do want to mention that the summit's webinar recording will be posted within 1 week on the Blanco Center's YouTube account. And we'll follow up with an email to all attendees to let you know that recording is up there and able to be shared out to anybody who is unable to join us today. We're also working on a 6-month report document, which we'll also give you an update on as soon as that's ready, that will sum up the activities so far and be able to be used as something that you can share with others as well, to kind of explain what Whole Health Louisiana is doing within this first 6 months and lead them to the Whole Health Louisiana plan, which spells out what it hopes to do over the next 5 years. So Without further ado, in the interest of time, I want to thank everyone again for attending. We look forward to seeing you at our next semi-annual summit on April 24th, 2025, where we'll be going over 1 year with this initiative and all activities that we have done within the span of a year. I hope that this was a helpful webinar to cue you in, and we'll stay on a couple minutes. If you have any further questions, feel free to ask, but the rest of you feel free to drop off at this time. So thank you all for attending. And bye all.